want to share great news. Dr. Peta Stapleton will be presenting at the 2020 Integrative Fertility Symposium. When I did this interview, we were in the talks, but now I can tell you it's official. She'll be doing a pre-symposium talk on using emotion freedom technique, that's EFT, for weight loss, anxiety, depression, pain, and manifestation. And she'll also be doing a talk during the symposium on EFT as a stress reduction tool. I use this for myself personally in my life, and I use this tool in my acupuncture practice, and I teach my patients on how to use EFT for themselves at home. And we are going to be opening her pre-symposium full-day lecture to the public as well. So this is one of those special times at the IFS history where the public can attend one of the pre-symposium lectures, which will be the one on EFT by Dr. Peta Stapleton. Anyways, check out ifsymposium.com and enjoy this interview.
Hi, Lorne Brown here. I'm a doctor of traditional Chinese medicine. My practice is in Vancouver, British Columbia, Canada. That's called AcuBalance Wellness Center, acubalance.ca. And today I'm talking to Dr. Peta Stapleton all the way in Australia. I got introduced to her through an email from the Dr. Joe Dispenza, and she has this lovely new book, The Science Behind Tapping, the Emotional Freedom Technique. I've been using EFT in my practice when I do acupuncture and laser. So it's one of those belief change modalities, also known as energy psychology. And I got really excited because I've been doing this since the early 2000s, and there is a lot of science and data showing that this stuff works. And so why not go to somebody who's published research, who's written a book, and is teaching people how to do this, to ask some questions. So we're here today with Peta, our expert. Peta, welcome.
Thank you so much. All the way from Australia.
All the way from Australia. So, and we're hoping that you get to come to Vancouver. We're in talks that Peta would come and do some lecturing around emotional freedom technique at the Integrative Fertility Symposium. Can you share with people I think they need to know a little bit about your background, would be great. And then kind of some of the research that you've been doing with the emotional freedom technique. Because I remember a story that your first introduction when somebody wanted to do EFT with you, you were like, that's a little out there. Stand back, please.
Yes, absolutely. So my background, I'm a clinical and health psychologist and a clinician. So I've been seeing clients for 25 years myself. Somewhere along the way, got into academia. So I'm now associate professor at Bond University here in Queensland, which is Australia's only private university. So we don't have, we have one private and the rest are public. So I just happen to be here now. And it was about 18 years ago now, Lorne. So it was that long ago that I was working with patients. Mostly my area is eating disorders, so anorexia, bulimia, nervosa, that type of thing. Anyway, my traditional training kind of wasn't working well in that field, so I was a bit frustrated. I was complaining to a colleague, as you do, that I've been to university, and doing a PhD, nothing's working. And he said to me, look, I've come across this really weird technique where you tap on these pressure points. I'm like, what are you talking about? And, I was a pretty conservative clinical psychologist and really did dismiss him. And I do write about it in the book. And he ends up coming along to a support group, and there's a young girl, she has a panic attack, and I'm trying to deliver this teaching lesson, and he takes her off. And they came back within about 5 minutes, and she was really calm and composed. And I felt convinced that he'd popped her a Valium or something in the back room, because she was so calm. And literally 5 minutes earlier, she was in the middle of a panic attack. And I said to him at the end of the night, what did you do? And he said, I did that tapping thing I've been trying to tell you about. And it was at that moment, because I'd seen a shift in her. I said, okay, tell me what this is. So I went off, sort of learnt it myself, gave up chocolate, my craving for chocolate in the afternoons. And somewhere in the next couple of years, I had the opportunity for research in my job. I was in the School of Medicine at the time, and said, well, why don't I start researching some of this? We're just seeing a little bit of research come out in America. And I guess the rest is history, because we're 15 years down the track now, and we've explored so many different areas. So I can chat about some of that if you like.
Yeah, I think the areas that you've been doing research on, because you've been doing it at some reputable institutions, and even starting with the weight loss and craving, because a lot of people are interested on natural ways where it can last, and just compare it with the other therapies. So maybe go right into weight loss and
yeah, and that you're right, that is where we started. So because I was in that field, And we have an obesity crisis here in Australia. So, 65% of adults here are overweight or obese. So we are facing that. And we were looking for, I guess, strategies that would complement sort of the diet and exercise field. And so that's where we started. And funnily enough, our very first trial, we're like, we'll teach people how to use tapping to kind of reduce food cravings, see if they lose weight over time. And it just might be a nice addition to what else they're doing. And we had 4,500 people come forward to be included in that trial because I went on this little current affairs show. My boss at the time, who was a conservative musculoskeletal GP, fell over because he thought nobody would want to come and learn this tapping thing for, your chocolate muffin or whatever it was. Anyway, we had thousands and thousands of people. So that's where we started. We eventually, obviously we showed in that very first early trial that it did work. People lost weight. We always do a minimum of a year follow-up to find out after the intervention, does it last? And we've now got up to 2-year follow-up. But we've compared tapping now to cognitive behavioural therapy for weight loss. And all of this is published so everybody can sort of get access to it. And really what we have been able to show is that tapping lasts over time, up to 2-year follow-up, so we have got that data, but it's superior in many ways to something like cognitive behavioural therapy in terms of anxiety feelings and even those kind of things like restraint ability and the severity of food cravings that within time, for the people that went through the CBT some of those things came back. The other thing that I guess stood out to us, and we've seen it over and over again in other trials, is the speed at which tapping works compared to some of our traditional approaches. And I'll just put out there that I teach at our master's level here in our psychology program. So I teach all of the mainstream therapies with all the evidence, CBT, acceptance and commitment therapy, motivational interviewing. We teach all of that. But the speed at which tapping works is quite astounding. So our participants get their outcomes in 8 weeks. And the CBT people do get their outcomes with food craving weight loss research, but it takes 6 months for that kind of day-to-day sort of practice of changing your thoughts and things like that. Whereas the old EFT tapping group got their outcomes in 8 weeks, lasted 2 years later. The CBT people sort of took a lot longer to reach those outcomes, and by 12 months, some of them had dropped off and they'd gone back to their baseline. Yeah, so it's where we've started. We've done about 12 years now of research in weight, and I've kind of expanded into other areas because I think we've proven it over and over. We keep finding the exact same results every time we run a trial.
And it's interesting because some people, if you criticize another modalities because it's not in your toolbox, so you have to make it wrong. I just want to clarify, you're trained in CBT, you teach CBT and EFT, so you're just sharing the data. So your facts are EFT gives you quicker results and it's lasting for at least 2 years.
That's right.
A thought I had, or a question I have, so 1 year, 2 year follow-up, I remember in your book and on some of the YouTube videos I've watched of you. And by the way, everybody, check out her website. The resources are phenomenal. So if you want to learn EFT and get the resources, website, it's petastapleton.com. Or is there a doctor in front of her or just Peta Stapleton?
Just petastapleton.com. Yeah.
Petastapleton.com. So just want to shout out for that because I send my patients links to that all the time. So thank you for creating that resource.
Thank you.
You mentioned that a year follow-up, some of them were like denial that they even had a craving for chocolate or eating disorder. So that's something that people would experience. Their memory is like, I don't think I should have been in the study because I really didn't have it.
They do. It's more common than we realize. And in the EFT world, they talk about that's sort of the apex effect. That's the description. That what happens when you use tapping for an issue, that could be a food craving, it could be a psychological symptom, it could be a memory, it could be whatever. That what happens is when that shifts, there is a neurological change that appears to happen. I talk about that in terms of memory reconsolidation theory in the book, about how that happens. That's sort of where we sit at understanding that at the moment. But what it means is because no willpower is required to continue fighting against that food craving or depressed feeling or cigarette smoking or pain or whatever it is, it's gone, people forget. So at that 1 year, 2 year follow-up, we ask them, and they do. They're kind of so surprised. They're like, what do you mean I had that food craving? And of course we have evidence because we have all their notes and feedback. And they laugh and they go, I haven't thought about that for, the last couple of years. And we're like, okay. But what they also do is probably not entirely attribute it to the tapping trial that they went through 8 weeks of 2 hours a week tapping in a group. They just laugh and go, oh, that doesn't bother me anymore. And then, of course, we laugh because we know what is happening here. But the brain truly is shifting. That neurological change is happening, and it's no longer in their present moment or mind or in their reality, which then means it's not an issue for them. So we're understanding more and more about how that happens, but it's a lovely outcome because some of our other traditional therapy approaches do require a lot of present mindfulness and diligence to sort of stay on track until shift happens. What we find is it happens at the same time we do the tapping, and they don't have to worry about it, which is, I think, fantastic. Yeah,
it's amazing. So check out Peta's website for that as well. And then for some of those that are like still sitting here a little skeptical, can you talk a little bit about the mechanism? So briefly, like, how does it work, this EFT? You talked briefly, but a little bit more about this mechanism, why it works.
Yeah, we've come a long way, I think, in our understanding. Like, both you and I, Lorne, got into this really way back in the early days. It's been around in my life for 18 years and, similar for yourself. And, we were really, I guess, relying on understanding a lot about the body's energy system, the Eastern philosophies of meridians in the body. I was finding in the early days that was really hard to talk to academic colleagues about. Like, they would glaze over and you'd kind of lose them as soon as you start talking about things like energy, batteries in the power pack upside down, things like that. What we've really done in the last decade, colleagues in America and certainly here, is we've done a lot of physiological research on EFT. So everything from measuring, what is happening in the brain and the body when we do this tapping thing physiologically. We've got 3 DNA studies that show tapping has a profound effect on DNA expression as to whether or not that gene expresses itself, and then, symptoms or illness associate with that. So those types of things, blood pressure, we talked about heart rate variability, cortisol, we've had that measured, blood and saliva cortisol. But then certainly fMRI studies. So we've been the first in the world to do an fMRI study in an MRI machine to look at blood flow and oxygen levels. We did it with food cravings. We have had a second study that's happened in America on anxiety in college students. So that's about to come out. And we're about to do a chronic pain one here in Australia. What we are showing is this tapping technique that is indeed impacting the amygdala, that stress center in the brain, by stimulating those acupuncture points, is changing the brain, is shifting. So we saw that, and the scans are in the book and they're on my website as well. So it's all published. People can see the before and after scans. What happens when you look at high calorie foods in an MRI machine is the brain starts to it's like a Christmas tree. It lights up like a Christmas tree. After 4 weeks of tapping, looking at the same images, it's like they've gone to sleep. The brain's just quiet. If there's no impact there, through the visual cortex into the brain, nothing happens. So therefore there's no desire. So we're understanding a much more, I think, robust picture of what tapping on these acupressure points is not just about making you feel better. And it's certainly probably way more than what we understood about. It's just changing the energy in your body. It's actually changing things physiologically, and we're showing it lasts over time. So I think we've come a long way, and that was my hope with the book, is that I wrote it really with, the layperson, thanks Lorne, the layperson in mind, to really understand, what does this mean, and how do I do it, but what does this mean, and what can we apply it to, and why does it work for such a range of different topics.
And that's the beautiful part, is it works. And as you know, using this ages ago, we had all our anecdotal stories. And now we have science, and thank you for the research. So we have science to confirm, because then it starts to get accepted, and then more people will access it because it's acceptable. A question I get, and I'm curious what your thoughts are. People always say, sometimes they lose focus, and they're concerned they're going to tap a negative thing into their system. So how do you respond to that question, that they're afraid that they're going, you're telling them to bring up the negative thought or feeling, and they're afraid that they're going to program that in?
It is an interesting question, because I think we live in such a world of positive affirmations and try and reframe and think more positively, that the minute you start to do tapping, you state what it is that is going on for you, which appears to be the negative most of the time. That's what people describe it as. So if I'm feeling angry, I'm going to say the words, I feel angry, as I obviously tap on that. So people do naturally think, am I not implanting this feeling of anger inside me? Because I think it's so counterintuitive to the rest of this positive world that we try to live in. What we say is that, in the original research done on the amygdala calming down when we do stimulation of pressure points was done by Harvard University. So that was a 10-year study where they looked at what happens when you stimulate pressure points, obviously with acupuncture needles in the brain. So that they showed the amygdala having a role in that. And that's what we're doing, is we're engaging the amygdala initially when we start tapping, because we almost need that presence to come up, whether it's the feeling or the food craving or whatever it is. And then it's the actual stimulation of those pressure points that makes the amygdala calm down. So we've got the research that shows how that works. It's just getting beyond the idea that we're not stating the negative, we're stating our truth in that moment. And the truth is whatever you feel. So instead of ignoring it, we are being quite mindful. So a lot of people are familiar with mindfulness. We're being really mindful and going, I'm not going to ignore how I feel, what is happening for me. But as I say that, I'm also going to tap on the pressure points. So thanks to Harvard, we have that kind of research, but at the same time, we now know through lots of the EFT research, it's the combination that works. So we have had 6 dismantling studies that have pulled apart all of the elements of tapping and done some of the elements without the rest to see what it's definitely the combination of stating the truth and tapping on the pressure points. And we know through memory reconsolidation theory that you do need to get in touch with it, engage with it, but then do an opposite reaction, a contradictory reaction, which is actually the tapping process. So yeah, it's all in the book if anyone wants to read further.
And I like, for those, that's the science. And then Eckhart Tolle in The Power of Now, his chapter 10 on surrender, they also explain it's counterintuitive, but you're accepting what is. Byron Katie, loving what is. Yes. This seems to be written about thousands of years ago, and beyond. Sages say that it's not that you're saying I like this. You're just accepting what is, and when you can surrender in the moment, healing happens. And so when I describe this to other healthcare providers or my patients, I tell them that it is a tool or gimmick to get you in present moment. That's all it is. It's another, because Eckhart Tolle in his book says, surrender in the moment. I always say, it's like when somebody says, eat mindfully, eat slower. Well, yes, I know that's good for me. How? Oh, put your fork down between bites. Put your sandwich down before bites. So be mindful, be present, surrender in the moment. How? EFT will get you in the present in the moment. And now we have data to show it's doing it. We can see the brain change. And I use whole brain from Psych-K. It's a form of brain kinesiology to get you. So it's another present moment tool. And that's what I think, that's what I don't know. I've never done research on this. That's what I believe EFT is also doing. It's helping us accept what is, getting in the present moment. And then it sounds counterintuitive, but when you actually look at what's bothering you, that's when it has an opportunity to diffuse or transform. I think this is fantastic. I hope we get you to Vancouver to the Integrative Fertility Symposium, because I know you've done research and there's stuff on, let's just list it, anxiety, post-traumatic stress disorder.
Yeah, post-traumatic stress, clinical depression, we've done a couple of trials there, cigarette smoking, chronic pain, we've done chronic pain, and we're doing more in the chronic pain space. We're actually lining up, and I may be able to talk about it early next year. We'll start a cancer trial late this year with an integrative medicine facility here in Australia. So we're actually going to use EFT to help support them through their traditional therapy approach, obviously chemotherapy and radiation, so quality of life. So we're starting a cancer trial. We have another fMRI trial starting in chronic pain as well. So we'll be looking at the pain process in the brain. Lots and lots, so many different things. Adolescent, teenage trials, test anxiety. Yeah, we've explored a lot here. I love doing it.
And I think at our conference, the craving weight loss, so we're having the self-care awaken the inner healer track at our conference. So it doesn't have to have anything to do with reproductive health. However, anxiety and post-traumatic stress disorder, infertility brings anxiety. People come with anxiety, miscarriages, unsuccessful IVFs, stillbirths, that will help. weight, people having weight issues or smoking, that will help also in that area. And just in general for the practitioners to deal with their own anxiety, feeling depressed, and be able to share this with their patients. So I'm very excited to be, we're almost there to get you to jump on that plane and come all the way from Australia to Vancouver, BC.
Yeah.
It's closer than Europe.
Absolutely.
The
Yes.
Integrative Fertility Symposium, Vancouver, April 2020. And then please check out petastapleton.com. Her website's full of resources. And I share with my patients. So they come in for the weight loss. They come in for EFT with the acupuncture for anxiety and for fertility issues and pain. And I now always send them your link, especially you have a whole online course for the public for EFT for weight. So now you can go there and do this online. And then what a resource for if you have a lending library like me, it's a great resource, and just for yourself. So thank you very much for taking the time to chat today. Thank you for writing your book. Thank you for doing the research. And I'm hoping we'll be able to secure you in Vancouver for April 2020 at the ifsymposium.com.
I look forward to it. Thanks, Lorne.
Thank you.
Fantastic.